time I visited another Rotary Club. I visited the South Austin Club, and Fred Burton from Statfor was the speaker. He was one of the more interesting people I'd ever heard, and he scared me to death with his global report, and I think that was about 10 years ago. Fred's partner for the last 12 years has been Ben West. Ben has been covering all sorts of events for Statfor since he's been there. He married a Rotary Peace Fellow 5 or 6 years ago, maybe 7 now. So I know there's been peace at home all this time. She was sponsored by the Oklahoma City Rotary Club. She's worked for the State Department for the last several years, so they've traveled to China, have lived in Ho Chi Minh City, known as Saigon, Belize, and will soon be heading to another assignment once she learns to speak the language. Ben was a graduate of McNeil High School up here in Northwest Austin, and went to Boston University and Johns Hopkins, studied in Italy there, and just has led a wonderful life that it's been fun to follow. So without any more ado, although I like ado, but here's Ben West.
Thanks, Andy. Thanks, Jim, and thanks, Brigitte, for having me here to talk to you all. I know a few of you. I updated you all. I think about 3 weeks ago now, when COVID-19 was just getting started in Central Texas. I think it was the day before the first cases were confirmed in Austin, and what 3 weeks? What difference is made? I'm sure we can all give a lot of examples how it's affected our own personal lives, and it's been a case of whiplash, just trying to keep up with everything. What I intend to go over today, I think last time I talked about kind of the threats to anticipate with COVID-19. What I'm going to do now, and thank you for Amber for adding that up there. What I'm going to go over today is basically what comes next. Over at Statfor, we have been, and for those of you who don't know, Statfor, we are a geopolitical intelligence company. As Andy mentioned, I've been with the company for about 12 years. We usually cover more criminal, terrorism, espionage threats to businesses around the world. We provide business continuity services and advice and consulting. Obviously, right now, and for the past 3 months, it's been COVID-19 and the effects it's had on the world. So what we're working on, I'm basically going to give you all insight into what we're working on a daily basis, which is the 12 to 18 month outlook. This is, basically trying to look, all right, what does the new normal look a year to 18 months out from now? And that forecast is still it's in the process, but what I'm going to present today are the factors and indicators that we've identified as kind of the most important aspects to watch. Thank you. And so just as a roadmap of where we'll be going today, what Statfor, what we have identified as the key factors to watch. Of course, there are hundreds, but if we have to boil it down to the most important 7, they are the behavior of the virus, and I'll get into more of these as we go on, but just as an overview: behavior of the virus, medical treatment options, government cooperation, government fiscal response, health system capacity, public response, and corporate response. So with that, we can move on to behavior of the virus. So the big question when it comes to the behavior of the virus is whether or not COVID-19 is seasonal, meaning like other strains in the coronavirus family, or most other strains in the coronavirus family, tend to reproduce more and be more dangerous during winter, colder weather months. That's why we see flu season in the winter. Previous outbreaks like SARS in 2003 were worst in the winter. COVID-19 itself began in November. The first cases in China were in November. So as we sit here in early spring, that's the huge. Will COVID-19 just kind of naturally fade out as the weather warms, or will it continue with the same strength that we've seen today? So the key indicators that we're watching for when it comes to behavior of the virus is in the Northern Hemisphere, how are we seeing the same number of cases and the social distancing practices that we've seen put in place? We would assume that between those two, we would see a tapering off by May and definitely by June. That remains to be tested. And even then, that does not mean that we're in the clear, because first of all, the Southern Hemisphere, we have to remember, is going into their winter. They're in early fall right now. They're entering kind of their flu season, their sick season. So if this is seasonal, we would expect to get much worse in places like Australia, South Africa, Argentina, and during the June, July, August, during their winter. Obviously, the virus has already made it to those areas. The question is, it's tended to be tropical countries and Southern Hemisphere countries have tended not to be as severely affected or have as high of a death rate. That's another reason why we suspect this might be seasonal. So we need to see if that changes in the summer. And then the next question is, does this, back to the previous slide, does this just resume in the winter? So we might see a dip during the summer, but then as we get into next fall and winter, we could see this rear up and just have a second wave, which actually has happened before. In the 1918 flu epidemic, saw 2 waves, and MERS, which is in the same family as COVID-19, has resurfaced year after year. Not to the same degree, but it's still there. I see some questions. Okay, so yeah, how is the virus behaving in equatorial climes, measurement or testing? So in general, when you look at tropical countries and southern hemispheric countries, they still have a lot of cases, but doesn't seem to be spreading as intensely or killing as many people as in northern climates. So that's one of the reasons why we think this might be seasonal. The issue with that is that testing is so, there's no real clear standard for testing. And so the question is, well, are we really seeing lower number of cases in the southern hemisphere, or are countries down there just not testing as rigorously? So it's a really difficult question to answer at this point. And unfortunately, we just have to wait and see. All right, now we can move on to the next slide. So the next major factor we're watching is medical treatment options. The big question here being, when will we see a vaccine? Those are obviously in production. A number of different vaccines and therapeutic drugs alike are trying to either weaken the virus so that to give people's immune systems better chance of fighting it off, or get a vaccine so that you have the antibodies and your body just has that immune memory to fight off if it becomes infected with the virus. This has obviously been a controversial topic as far as timeline, and I think everyone really kind of needs to be realistic that this is still in the very, very early phases of testing. It needs to go through a testing process, approval process, production needs to be stood up. distribution needs to be figured out. There are a lot of steps that need to happen in order to get a vaccine ready for the market that's confirmed to be safe for humans. And obviously we want to get it right so that we're not actually infecting people with COVID-19, which is a risk. And so even when a vaccine is created and stood up, it's going to be distributed on an as needed priority basis. So we have to assume that healthcare workers are going to be probably the first recipients, followed by elderly and otherwise vulnerable people. And so if you are a young, healthy adult, you're probably in the third or fourth tier of importance. So for this reason, we're assuming that we're not going to see widespread vaccine availability for at least 18 months, probably more like 24 months. So if you do the math and go back to the previous slide, we're talking about 3 to 4 waves of COVID-19 if this is in fact seasonal before we have a real cure for it in the form of a vaccine. Okay, yeah, sorry, you can go to the next slide. Now we get into kind of more of the external forces where I think we really don't have any power over whether this is seasonal or not. Vaccines can only be created as fast as science can allow. But I think areas where we do have power over is when it comes to government cooperation. So far, I think it's fair to say there's been a very disjointed response, both within the United States. The United States is not alone. Many other countries are seeing the same kind of disparate response between the national level government and regional and local governments. Mostly just because, as we've seen, this is a virus that tends to impact heavily populated urban areas worse than rural areas. So if you live in a city, you're panicking because this is going to really impact your population. Whereas if you're living in a more rural area, it hasn't yet had that much of an impact on you. So I think that's one of the biggest kind of reasons between the disparate responses we've seen so far. But as far as what we're looking for here, looking for some degree of harmony, harmonizing the policies on a national, state, and local level on what are some just common denominator measures that we can all adopt and what's appropriate. And this is getting kind of aspirational, but thinking internationally, if we think back to previous crises like September 11th attacks and the global financial crisis in 2008, 2009, we saw the world come together to have a unified response and kind of figure this out on a global level. And we haven't gotten there yet with COVID-19, and it remains to be seen if we do see some sort of global summit, or of course it would have to be virtual, or agreement on how to deal with this, both from a public health and economic point of view. And we can go to the next slide, please. And so, yeah, that also brings us to the government fiscal response. And this will have a big impact on some of the forces that I go over in the next slides. But, we've obviously seen the relief package that the US government approved last week. Will governments continue to offset the economic pains caused by social distancing policies with financial assistance? What we saw and what we've seen from most governments around the world are kind of one-off responses where there's a certain amount of money injected in the economy to help employees and companies and industries get through the next month or 2 months. But as this continues, and as we might see further waves of this going into the next year, are we going to continue to see piecemeal responses, or do we see a more comprehensive economic package to try and offset these disruptions? And one thing we're even considering too is really some more radical economic policies that might have seemed extreme a few months ago, but under the current circumstances are entering debate. And that's when it comes to things like healthcare, expanding healthcare coverage to everyone, or having some sort of universal salary where everyone gets a certain amount of money a month, or even really getting in and tinkering with the national debt structure and how the government is allowed to take out debt. I mean, I think all these things are on the table, especially as we get into the coming months and years of this being an issue. And I'll use that to go back to a previous point. When it comes to treatment options, because vaccines and treatments do seem to still be pretty far off, really the only way to treat this right now is through social distancing, by staying at home, by reducing interaction with others. And that obviously has a huge economic toll. People aren't able to work, demand has plummeted. And so that's why that government fiscal response is so important. If you want to continue social distancing as your main policy, you've got to have some economic relief to make up for it. So yeah, we can go on to the next one. Okay, so health system capacity. This is basically, will health services be able to keep up with the number of severe cases, or will the health system collapse? And the way we're measuring this is looking at the number of beds and ICU spots available to patients. Again, this is more severely impacting urban areas than rural areas. Looking at the infection rate among medical workers, obviously medical workers on the front lines, we're seeing high rates of infection among them. If they're taken out of hospitals, that just leaves fewer personnel to tend to the sick. And then obviously also the shortages of personal protective equipment and things like ventilators and respirators. Are we able to overcome those shortages and increase production, or otherwise figure out how to overcome those gaps? And then next slide, please. Public response. So and we start, all these factors obviously work together to form different scenarios for our forecast. With the public response, this is getting into really interesting territory. This is, basically, does the public comply with the official policies, which are right now, the official policy is basically social distancing and restricting movement and restricting gatherings. Depending on where you are, you're seeing different levels of compliance. I think a lot of people are more than happy to comply because they know they're at risk. Others, and this gets back to the economic question, for people who depend upon having to physically be at a work location to work, the social distancing, it comes at a huge economic cost. And that's, we're still in the early days of this. People can get by on their savings, maybe the relief from the government. But again, as this drags on into potentially months, there's going to be a real tension there between people who are which comes first, basically, public health or the economy. Public health or people's ability to provide for their families, and that's sets up for pretty huge social conflicts. And what we've seen elsewhere in the world, so far I think things have been pretty peaceful in the United States, but elsewhere in the world we've seen tensions escalate between police and civilians. President Rodrigo Duterte of the Philippines, who's been kind of notorious for encouraging police violence, he has basically authorized police officers to shoot people who are violating curfews and lockdown orders. That has led to protests and social unrest. We're also looking at cooperation from religious groups. A lot of these kind of super spreading events around the world have been linked to religious events. Going to church or mosque or synagogue or temple or whatever, obviously you're around a bunch of different people. those have unfortunately been linked to outbreaks. And as we see Easter coming up next week and Passover, how will communities around the world, will they stick to those lockdowns and avoid congregations, or will they congregate and risk for their outbreaks? And then finally, again, the economic viability of social distancing. How long can people abstain from work before they just can't anymore and are willing to break the law to go back to work? So we can go to the next slide, please. So finally, corporate response. This is very similar to the public response factor, but basically looking at what do businesses and companies, how do they comply with the official restrictions, or do they challenge them by reopening? And the indicators we're looking at here is basically the definition of essential is very fuzzy and quite honestly can be changed with some lobbying. So, what companies are able to continue operating basically because they can make the argument. And, again, that balancing the need for public health and economic health at the same time. And then, for those companies who do decide to reopen and push, kind of push the envelope on the social distancing policies, how do law enforcement and governments respond? Do we see, and we've seen a few cases where especially in Europe, where police have gone in and forced a cafe to shut down. But, if you were to see a bigger, more reputable company come back to work, are politicians and police going to go in and force them to shut down? And of course, that can lead to showdowns and more social unrest. So it's dizzying to think about the ways this could all go wrong and the amount of conflicts this creates within the population. And I think that's basically what we're looking at. And believe, is there one more slide? Oh, so actually I had added one more slide to my own copy. Before I show that though, I just wanted to kind of summarize. So these are all the factors and indicators that we're watching for. These are basically how our guidelines for making the forecast for the next 12 to 18 months. And what we've come to is, first of all, this is the third forecast we've done now on COVID-19. In each case, our best case scenarios have all been overtaken by events and basically are not valid anymore, aren't even practical. And while our worst case scenarios have increased in probability. So the trend seems to be that this is going to be worse than we're expecting. And we're still in the process of basically calibrating our forecast to figure out how bad this is going to be. But what we're basically assuming, if we go back over all those factors, we're assuming a level of seasonality with the virus so that we do get some natural relief in the summer, but then it will come back in the winter. We're assuming that there will not be a vaccine until 18 to 24 months, but that there will be some therapeutic possibilities. So some ways to maybe treat the symptoms and reduce the death rate, if not eradicate the virus altogether. We're assuming a low level of government cooperation just because this is impacting different regions so differently. It's going to be really hard for governments to get on the same page, which will make the response more difficult. We're assuming that government fiscal response is going to be continue to be piecemeal as needed. But we're really watching for, who's going to be the first country that goes in with a really radical economic response to this, and could that open the floodgates for more to follow? For health system capacity, we're assuming that seasonality and the eventual therapeutic medicines will lower the burden on the health system, so that, you know, the hospitals will be able to continue to function as we know them. We're expecting public response to be, if anything, more conservative than what governments are asking for, just because as this gets worse, I think there will be, and as people start, you know, as people start losing friends and loved ones to COVID-19, I think it'll have a more personal impact. And so I think people will kind of self-regulate. And then corporate response, we are assuming that companies are going to more or less comply with the obvious outlier here and there. So that's it for me. I will give a quick Stratfor plug here. We're covering this, you know, on an hourly basis. We're putting out a lot of analysis on all different angles of COVID-19. Please drop by our site, stratfor.com. If you're interested in a subscription, it's stratfor.com/subscribe. Is there on the webpage. And thank you all for your time. I moderate that.